First of all, let's say thanks to our God, Allah Subhanahu wa Ta'ala, who has given us some mercies and blessings so we can attend here in a good condition and also happy situation. Dear audience and all the participants, I would like to say welcome to the guest lecture of Faculty Health Sciences, Universitas Muhammadiyah Lamongan 2025. I am Masunatul Budia. I'm a nursing lecturer, especially in nursing study program, Faculty of Health Sciences, Universitas Muhammadiyah Lamongan. I'm honored to be your master of ceremony this event. So before I start this meeting, please allow me first to read our agenda today. The first agenda is opening, the second one is reciting the Holy Quran, and the next is singing Indonesian national anthem and Mars Muhammadiyah. The next agenda is opening speech, lecturing, and the last is closing. So let's start our agenda today by reciting Basmalah together. Bismillahirrahmanirrahim. We hope our agenda today can run smoothly. Amin, amin, ya Rabbal Alamin. And the next agenda is reciting the Holy Quran that will be delivered by Muhammad Wildan Nabil Agung Pambudi, a student of nursing study program, Universitas Muhammadiyah Lamongan, to Muhammad Wildan Nabil Agung Pambudi. Times is yours.
Assalamualaikum warahmatullahi wabarakatuh. A'udzu billahi minasy syaithanir rajim. Bismillahirrahmanirrahim. Laqad kana lakum fi rasulillahi uswatun hasanah. Uswatun hasanatun liman kana yarjullaha wal yawmal akhir wa dzakarallaha katsira. Uswatun hasanatun liman kana yarjullaha wal yawmal akhir wa dzakarallaha katsira. ولما رأى المؤمنون الأحزاب قالوا هذا ما وعدنا الله ورسوله قالوا هذا ما وعدنا الله ورسوله وصدق الله ورسوله. وما زادهم إلا إيمانا وتسليما. صدق الله العظيم. والسلام عليكم ورحمة الله وبركاته.
Thank you so much. And the next agenda is singing National Anthem Indonesia Raya and Mars Muhammadiyah. For all audience, please stand up. To all audience, please have a seat. Ladies and gentlemen, our next agenda is opening speech that will be delivered by Dean Faculty of Health Sciences, Universitas Muhammadiyah Lamongan, to Ibu Dr. Firgianti Nur Faridah, Master of Nursing Science. Time is yours.
Good morning, everybody. Okay. Assalamualaikum warahmatullahi wabarakatuh. Rabbi israh li sadri wa yassir amri wahlul 'uqdatam min lisani yafqahu qawli. Excellency Mr. Neil Madulara Martin, PhD, MN, MEN, MBA from Mindanao State University, Iligan Institute of Technology, Philippines. Respectable all Vice Dean, Head of International Affairs Office, and Lecturer of Faculty of Health Science, Universitas Muhammadiyah Lamongan. Honorable all my students whom I love. First of all, let's pray and thanks to our God, Allah Subhanahu wa Ta'ala, who has been giving us some mercies and blessing so we can attend and meet in Zoom in good condition and happy situation. Secondly, my peace and salutation always be given to our Prophet Muhammad sallallahu alaihi wasallam, who has guided us from the darkness to the brightness, from the stupidity to the cleverness, from Jahiliyah era to the Islamia era, namely Islamic religion that we love. So, by his guidance, we are able to differentiate the good thing and the bad one, and the right way and the wrong one, in order to enter God's paradise. Thirdly, I'd like to say welcome to Mr. Neil Madulara Martin from Iligan Institute of Technology, Mindanao State University, Philippines, in Universitas Muhammadiyah Lamongan. Thank you for your time to give guest lecture about the theme ensuring a culture of patient safety in Philippines. We hope you can deliver information and knowledge about collaboration role between nursing, midwifery, pharmacy, physiotherapy, hospital administration, and occupational safety and health in patient safety. To all my students, I am sure you'll get a lot of advantages. You can improve your English and enlarge your friendship. Also increases insight into patient safety abroad. Please do participate in the golden opportunity, and I hope your participation will bring some benefits. Thank you to all the committees who have overseen this guest lecture event. May it be successful until the end. Furthermore, the guest lecture event of the Faculty of Health Science with the theme Ensuring a Culture of Patient Safety in the Philippines is officially opened by reciting Basmalah. Bismillahirrahmanirrahim. Okay, I think my speech is enough for this time. If you find some mistake in my remarks, I hope you to apologize me. Thanks a lot for your attention. Wassalamualaikum warahmatullahi wabarakatuh.
Thank you for the great opening speech by Dean Faculty of Health Sciences, Universitas Muhammadiyah Lamongan. And now we are going to the main agenda, which is lecturing. So before I start our agenda today, I would like to ask our audience first. Do you know what is the topic today? Okay, what is the topic today? Okay, you can read the topic in the front of this. Yeah, about the ensuring a culture of patient safety in the Philippines. So, in this session, I'm being moderator, so I will guide you until the end this session. Okay? Okay. Okay. I think all of you know about the patient safety, right? Yeah, because you are from Faculty of Health Sciences. I believe and I'm sure that all of you have known or have heard about the patient safety because this is the important things when you are to work as the health worker in the hospital or and also in clinical. And in this special day, we also invite our speaker from Philippines. So we are today already connected with Mr. Neil. Maybe we can say first, good morning, Mr. Neil. Please unmute your audio.
Good morning.
Okay,
Good
good
morning,
morning. Okay, nice to meet you, Mr. Neil.
Yeah, it's my pleasure indeed. Thank you.
Okay, thank you. So I just give you suggest to all of the participants, please pay attention and also listen carefully because you have many advantage when you join this guest lecture or this international agenda because you don't need go to Philippines. You just sit here, you can get more information regarding the patient safety and how to collaborate and also how to practice the clear culture of the patient safety in Philippines. So if you wanted to make a note, just take your paper and then make a note. And this is and the last of the session, we have question and answer session. So all of you can ask about our topics today. Okay? Is it clear for you? Okay. Okay, before we start our meeting, maybe I would like to introduce our speaker first. Wait a few minutes. Okay, our speaker today is Mr. Neil Madulara Martin, PhD. Neil Madulara Martin, PhD, an associate professor. He is a clinical instructor and also international affairs coordinator of the College of Health Sciences, Bachelor Nursing, Mindanao State University, Iligan Institute of Technology, Philippines, and also he has a lot of publication and also books, so you can visit her publication maybe on your Google Scholar and also your Scopus ID. So the operator already present about the CV of Neil Madulara Martin. So without ado, so the first session is presentation. So to Neil Madulara Martin, time is yours.
Yes, thank you very much. And to the moderator, Ms. Masonatu Ubudia, thank you. And I will do formal talk while I'm sharing my screen now.
Yeah, you can search by your
Yes.
own.
Yeah. How about that? Can you see my screen?
Yes, actually.
My slide in my screen. All
Yeah.
right. So, yes, good morning from the Philippines. And I would like to bring greetings. In Philippines, we say magandang umaga po. All right. Can you try that? Magandang umaga po. All right, so it's actually good morning. So I would like to bring greetings to all of you out there from your Dean of the Faculty of Health Sciences, Dr. Verhientinor Farida. Good morning, Doctor, the Dean of the Faculty of Health Science, and the rest of the faculty, and the participants of this guest lecture series. This is actually represented by the students coming from the diploma in pharmacy for the second or for the fourth semester or the second semester, the midwifery, the second and the fourth semester. Hello, can you wave your hand? The physiotherapy, and then the bachelor in midwifery, sixth semester, and then the nursing, fourth semester, the pharmacy, fourth semester, science in hospital administration. Can you wave your hand? And the occupational safety and health. So all of you are actually invited by the organizer to collaborate with our university, Mindanao uh, MSU IIT, or the Mindanao State University Iligan Institute of Technology. We are actually in the Philippines. If you can see the map, we are actually going down from Manila, that is actually forming part of Luzon, Visayas, and Mindanao. So that's the name of our university. So I bring greetings, and I would also be presenting my outline of presentation today. It will cover some terminologies that will help us understand or familiarize how we're going to use these terms. And then there are questions in the outline of presentation. We can actually ask ourselves later, what is patient safety? Or the moderator already asked you, what is the topic for today's lectures here? Lectures. So that is actually what we're going to talk about. And then hopefully you'll be able to familiarize. And then the second question is, how is patient safety culture measured? And then where does patient safety culture exist? And what and why of the SOP surveys or the so-called research, and then what SOP surveys of setting of care have been developed, and then what are those added to the SOP surveys, core surveys to assess additional content area of focus. And then we also ask the question, how SOP survey process done? And then what are the areas of patient safety culture assessed by the SOP surveys, and relating SOP patient safety culture survey data to outcomes, and what does the literature say? So most of the literature I have gathered, only a few, will talk about the Philippines. And by the way, I actually am honored and privileged to have this presentation with you because of the invitation of Universitas Muhammadiyah Lamongan through your International Affairs Office, Ms. Noor Hidayati. So I am really honored, and I would like also to show to you a bit of our entrance of the university. Currently, for the year 2025, we are actually ranked with a THE World University Ranking in Asia, and that is actually number 601 plus in the Asian University Ranking. That makes us second in the Philippines. And then for World University Ranking, we are actually 1,501 plus. And for physical sciences, we are actually 801 to 1,000. So hopefully, you can actually visit our university in Mindanao, Philippines, and or you can actually Google and then visit our website. So we actually have this mantra on influencing the future. So, like for this session, we actually say yes with the approval of my dean, Dr. Mangaron, and we are also honored having been supported by the International Affairs Office, Dr. Joey Martinez, and our Chancellor, Dr. Professor Alice Sidney Didukalan. So here are three objectives for the session. All right. Number one, as I have mentioned earlier, you are expected to familiarize, all right? You don't have to memorize. You just have to familiarize with common terminologies used. But if you wish to memorize or study further and try to understand and comprehend what are those terms, how is these terms being used, then that would be very helpful for you as a student in healthcare. And number two, this is very important because if we try to listen to the concepts about patient safety or safety of patient, the SOP as acronym, we need to introspect. When we try to listen and then try to internalize, try to reflect, then that would be something very helpful for you along the way of my presentation. And then the third one is translate. So there is a need for you to apply, right? So with this, you are expected to translate the learned concepts into a given actual work or the case scenario, particularly with your individual client and in wherever your clinical setting would be. So you can be in the delivery room, you can be in the pharmacy, you can be in the laboratory, you can be in the ward, you can be in any parts of clinical practice setting, then hopefully you'll be able to relate and translate or apply these simple basic concepts on patient safety. Now, remember this, okay? This is actually what we have oath or pledge to our profession. All right, when you are still students, you go into the ladder of like ceremonies. When you are done with certain prerequisites, then you are asked to make a pledge, or you can have the so called oath taking, or you can actually have some ceremonies about trying to tell the public that you are ready to face certain challenges at a certain level of the curriculum, right? Okay, so I hope that's how it is that you're going to relate that we have pledged something. And this pledge would be, okay, very clear. It is first, we do no harm. Okay, can you repeat that? Do no
Not
harm.
harm.
So
Do not
please,
harm.
let us remember this all the time because this is the most fundamental principle of any healthcare service that we are actually providing to our clientele. Okay, repeat, do no harm. So no one should be harmed in healthcare. However, there is compelling evidence of huge burden of avoidable patient harm globally across developed and developing healthcare systems. All right, so Asia, for example, we are towards the developing country to compare with the European and the Western countries. So we are having that problem. Okay, so try to look into this now. This is the scenario that we are actually compelled for huge burden of, take note, it's avoidable. We can prevent this, okay? And yet it is actually being experienced globally, not just only in Indonesia or in the Philippines, but in Asia also, but the whole world. So that's why I bring you back to all of our chance of promising and pledging and taking oaths that we do no harm. All right? Clear on that? So do not harm anyone as possible. So that is actually a concept or a principle in ethics that we can actually connect. Why are we doing this lecture on patient safety? We must be reminded that first, do no harm. This is a fundamental principle that guides us in our practice. Now, we're going to define patient safety according to the World Health Organization. So, if you can read through the screen, it says that the World Health Organization defined patient safety as the absence of preventable harm to a patient So we try to prevent harm to the patient and reduce the risk of unnecessary harm associated with healthcare to an acceptable what? Minimum. All right. So we can actually consider some experiences of risk and harm, but at least at the minimum, not to the maximum because it will actually lead to patient's death. All right. So within the broader system, this is now the setting. Okay. Patient safety can be in the context that is broad in the healthcare system. That's why it's you are fortunate enough that you are being gathered by your professors or the faculty of health sciences or allied health professionals so that you'll be able to discuss further after this lecture that each of you has a particular and vital role to play. Not just only nursing, not just only pharmacy, not just only midwifery, not just only physical therapy, occupational therapy, not just even like only teachers, but all of us in the healthcare system. So we have to contextualize that. The setting is where we are having our patient and that we have to avoid possible. We do no harm, we avoid harm, and we reduce the risk. Okay, are we clear on that? And remember this we follow the framework of organized activities. All right, so these organized activities will actually be done regularly, and that leads in the development of a culture. Would you agree with me? All right, so culture. Uh, Definitely, if you do it every day of your life, that's part of your system. That you do not do harm. There will be absence of harm to the patient. We try to prevent the risk, and we try to harm the patient possible. Then we have now created a culture of patient safety. All right, that's culture, and we talk about processes here, okay, and procedures, and most importantly, your behavior. Can you repeat that word? Behavior. All right, so this is actually an action of what you perform because of your understanding of patient safety. Now, if you understand patient safety, then you prevent harm to the patient possible. All right, where? In the healthcare system. All right, that's behavior. And most currently, with the emerging trends of robotics, digitalization, AI, now we merge technologies in our practices. So we have to be very careful all the more because at any rate, we are not much familiar with technologies. And so we have to make sure that we do not cause harm to the patient when we use technologies. So there are protocols, safety protocols that we have to follow according to the healthcare facility, and then wherever units that we are, then definitely we follow all these things. So technology has a very important role to play, yet we have to be very cautious. We have to be very critical about patient safety. All right? And then environment. Very important is environment around us. Then it actually offers a lot of possibilities of risks. Exposure to risks like radiation in radiology, for example, or in the laboratory, or in the whole environment, especially later on when we try to talk about the challenges of the 2025 on patient safety, particularly to our colleagues in the profession. We are actually at most higher risks to be contaminated with a lot of bacteria and viruses and pathogens in the hospital setting or in the healthcare system. All right? So that's environment. And consistently, we are going to sustainably lower risk, reduce an occurrence of this avoidable harm, which means to say we can prevent, make error less possible, and likely reduce impact of harm when it does occur. All right. I hope that's where you are situated now in your understanding of what patient safety is, and then the how we're gonna be moving towards ensuring a culture. All right. Day to day, when we practice all these things, then it becomes a culture. So in the Philippines, we follow. We are actually looking into 4 in 10 patients, according to the WHO, that are harmed in primary and outpatient healthcare. Okay, are you with me? And the screen, out of 4 in 10 patients are actually harmed either in primary, the first level, or outpatient. All right, so that's the setting or the environment. Then there is really a call to speak up for patient safety. And in the Philippines also we follow this. We create a patient safety culture through ownership and engagement of staff. So remember this, it's not just only the healthcare practitioners, but also the people that we work with in the organization, like the staff. They're very helpful, the institutional workers, all right? And then we also have to do some reporting and learning from errors. All right, I think you're familiar with incident reports, all right, or some narratives or the letters that you're going to submit. What happened? How did it happen? Who were involved? And then what were the reactions? And then etc. So that's reporting. Very important. And then if you do so, then slowly we create the culture of patient safety. And then leadership. Okay. So our leader in the faculty is our dean. So it's good that the dean approved this lecture because she believes that all of you, and even emphasized by the moderator, that you can learn how Philippines is doing, and perhaps similar to Indonesia, then you can actually apply it. Or later on, I will also be using some Western material, and we can actually look into it. All right. So that's number 3, the leadership commitment to a blame-free environment. Okay, I hope that you are not blamed, and then students are afraid to write down what took place during that incident because it's actually a negative feedback from them. Then, of course, perhaps the faculty or the teacher in charge, the preceptor, might be scolding or might be angry because of what had happened. So I hope we will try to shift that to a blame-free environment. Would you agree? All right. So then, open communication across all levels. So we need an open line of communication. Okay. So, and then lastly, we work as what? Can you read it on screen? We work as a team. Very good. So teamwork is very important when we create or we ensure a patient safety culture in our organization. All right. So I hope that's clear regarding this slide. Then there are patient safety key factors that we have to consider to face the challenges of the 2025 patient safety challenges. So, like number one, according to the World Health Organization newsroom, it says that around 1 in every 10 patients is harmed in healthcare, and more than 3 million deaths occur annually due to unsafe care. Okay, so remember this. These are all possible, preventable, avoidable circumstances, and it will be where we take our roles. All right, as a midwife, as a nurse, as a occupational therapist, as a pharmacist, as a physical therapist, as a health allied patient safety worker. All right, so these are facts that we have to have it in our mind so that we will be guided accordingly. And take note of this. In low to middle income countries, that we fall under that, as many as 4 in 100 people die from unsafe care. So we have to be very careful, very critical that at any rate, we can help an individual, an ill patient, move towards recovery rather than death. And then the third one is about 50% of harm, one in every 20 patients, is preventable. Half of this harm is attributed to medications. Right. So be very careful, nurses or any health practitioner, when you prepare medication like the contrast or like medication per orum, intradermally or IM subcutaneously, like injections, IV fluids. Make sure you follow the principles and be very certain about the 12 or R's in medication error to avoid medication error. So preparation, administration, you have to counter check it from time to time. All right. Noting about the right dosage frequency, the right drug, and then the right route, and all the R's that has to be fully understood and be carried out by you. All right. So that we will not or we will avoid or minimize medication errors. All right, are you still good? All right, then we move on to the fourth. So some estimates suggest that as many as 4 in 10 patients are harmed in primary and ambulatory setting, while up to 80% of this harm can be avoided. I think that's very clear to you that in everything that we do, we have or we can prevent or avoid errors. We can prevent and avoid harm to our patients. And then common adverse events that may result in avoidable patient harm are, yeah, mentioned medication errors, unsafe surgical procedures, healthcare associated infections. Take a look at that. This is what I told you that in the floor, in the ward, we can actually contract uh, infections. That's why it is called healthcare associated infections. At our end, to avoid and prevent, we have to make use of PPE, okay? Or like we make use of our face mask, all right? Or we always do hand washing technique very strictly possible so that we can avoid and cut the cycle of infection. Okay, are you with me? Very simple ones to really avoid um, risk. Okay, so then unsafe blood transfusion. Take a look at this. Remember, there are protocols to follow for blood transfusion, just like your blood typing, cross matching. All right, so make sure that you're working on it. And then it has to be with a colleague that you're gonna check for the blood type, for the cross matching, and then for the serial number and what have you, codes, whatever it is, to avoid unsafe blood transfusion administration. And of course, thromboembolism. Then next is patient harm potentially reduces global economic growth by 0.7% a year. On a global scale, the indirect cost of harm amounts to trillion of US dollars each year. And that investment in reducing patient harm can lead to a significant financial savings. How? How can we make savings out of this? Then it is through a good return of investment in patient engagement, which is, if done well, we can reduce the burden of harm. That's why, if I can relate it with nursing or any health professionals, in everything that we do, first, we identify the patient. And then we also have to consider other identifiers that could you tell me your name? Could you tell me your birth date? All right. And then check the wristband or like check the doctor's order. Okay. So that we actually perform the right procedure to the right patient. All right. So then when we try to engage patient, very important, we try to communicate, we try to give instructions, then definitely in this patient engagement that we have, we can actually make financial savings by reducing the burden of harm. All right? Then we move on to this Western, I should say Western Agency for Healthcare Research and Quality. So they said that the agency said patient safety culture is the extent to which an organization's culture supports and promotes patient safety. So they're actually an advocate and an agency that promotes patient safety. So the same thing with Universitas Muhammadiyah Lamongan, you are an organization that supports and promotes patient safety. Am I right? Can I see a thumbs up? Okay. So then we are in one direction to promote the culture of patient safety. And then, of course, here also in MSU IIT, we also do the same in the Philippines. Now, this culture, patient safety culture, refers to our values. Do we value this? Do we believe in this? Do we have some norms like the healthcare practitioners and other staff throughout the organization? Are they influenced with their actions and behaviors? All right. So AHRQ, or the Agency for Healthcare Research and Quality, supports that. Now let's look into our values as healthcare practitioners. Do we value life? Do we value human dignity? All right? Do you believe in it? And is it a shared norm that we have to respect the dignity of a person? If so, then we are in one direction. We can all together promote and advocate patient safety culture in our organizations. How? By influencing, by modeling our actions and behaviors towards preventing, avoiding certain excuse me, certain risks and harm to our patients. Okay? Furthermore, the question of how can this be measured? So, patient safety culture can be measured by those items I mentioned that is related to patient safety and that are actually in organizations. They can be rewarded, they can be supported, they can be expected, and very important is accepted. So, meaning to say, the values, the beliefs, the norms, and behaviors as one organization are actually geared towards patient safety. Then there are mechanisms to reward the efforts of our actions. Okay, so um, there could also be some forms of support from administration or management. So that's why leadership is very important here, and topmost administrations and management is helpful to support us, and then they also expect us to do something. Then both of us are expecting support, and then we carry it out, and then you carry it out, they will support, and then vice versa. They can also give award, and then eventually it becomes a culture. Why? Because everyone accepts the idea or the concept that we have to prevent and avoid harming our patients, harming our colleagues, especially on workplace violence. Now, workplace violence noted are actually coming from the patient, but also it will also be coming from colleagues. So be very careful in that and be very sensitive about that. So then definitely it's actually a consensus that all in an organization accepts all these things as a culture, and then we move towards our goal. So it is important to note that culture exists at a multi-level. Say for example, coming from the unit, coming from a department, coming from an organization, and the whole system level. All right, remember this. Medication error is not attributable only to unit or to an individual person, but it actually redound to the whole system. Okay, so what comprises the whole system? Individual, and then the employer, the unit, the department, the organization, and it represents the system. Now, take a look at this illustration here. Okay, can you see it well on screen? All right.
Yes.
So this refers to the organizational culture. So if you have the beliefs, the values, the norms shared by each of the healthcare staff, then definitely it determines behavior that are rewarded, supported, expected, and accepted. So this is what I've been telling you. And that if it exists at a multiple level, then it can start with unit, department, organization, and system. I hope that's clear to you. And very simply, in one schema or in one model, then you will be able to uphold to a certain noted organizational culture of patient safety. All right? Okay. So then, there is also a question: what SOPS surveys measure patient safety culture? All right. So here, actually, AHRQ conducts surveys. So this is related to research. Okay. So when we try to promote and ensure patient safety culture, then we do some form of researches or the surveys. Okay. And that the purpose is to assess the extent to which their organizational culture supporting patient safety and safe practice. Take a look at that. Patient safety and safe practice. Can you repeat that? Patient safety and safe practices. So, the whole organization, like Universitas Muhammadiyah Lamongan, or a certain department, then each of you will have to work on and then eventually represents the whole system of survey, the whole system of data gathering and research method that will actually develop and support the organization to provide each of the staff, each of the students, each of the administrator data that will actually support patient safety culture. All right, so let's move on. So SOP surveys have been developed for the following settings of care. Where is this located? Hospitals, medical offices, nursing homes, community pharmacies, and ambulatory surgery centers. Or could be, especially in government sector, then you go to the community level. All right. So then you have the health centers, or you have the first, second, and third level facilities of care. Then definitely that is where the survey can be considered, developed, and actually being practiced. All right, moving on. These as surveys are supplemental item sets that they undergo rigorous development and testing process. So this is really like a formal research process because the survey asks questions that have been developed and there is a need to pilot test using a consistent methodology. And not just only a few people, but it's actually across a large sample of respondents. They are standardized and validated measures of patient safety culture. So on and on, this is really a serious matter. It may be taken lightly or trivial. It might be trivial to you, but after all, this practice must be considered to be a very critical and serious one. So there are areas of patient safety culture being assessed by the SOP surveys. What are these areas? Number one, mentioned earlier, and part of the challenges of 2025 is communication about error. Okay, so incident reports, reporting, conferences, it's being done. Number two, communication openness. Very important. Day to day, we have to talk to our patient. We have to give them information. At the same time, in our team of professionals, like the cohort of team members in upcoming surgery of the patient, that there has to be some open line of communication. Number three, organization learning. So if you're familiar with continuous improvement, this is actually a product of researches and surveys that will actually improve day to day or like quarterly or from time to time, that our care must be optimum possible, and that will actually redound to patients satisfaction. Okay, are you still with me? Then the overall rating follows on patient safety. Then response to error. What have we done? Or staffing. Because you see, if we lack staff or personnel covering a lot of patients, then it will redound to burnt out. Okay, so there could be some problems of health already from the health providers. All right, so staffing is very important. And then supervisor and management support for patient safety is also very important. Preceptorship, for example. And this activity is very helpful for you because it will give you an opener of what it takes really to be serious and critical about the simple, trivial item on patient safety. All right? And then teamwork, remember, teamwork is very important. And then work pressure and pace. So listen, each of this is assessed by multiple survey items. All right? So it's not just only one, but many factors. That's why it has to be seriously done. And then it has to be a robust research process. Although term a survey, kind of simple, but it actually requires the team to work on it so that it will enable reliable measurements and facilitate patient safety culture improvement efforts. All right? Remember that. It will facilitate patient safety culture improvement efforts. And that in addition, survey items are customized for its setting of care. So, like, it must be more or less similar, and there are some structures to follow, and then questions to ask so that it will be more consistent in a certain group of people. That's why it's customized for each setting of care so that it will be more of our concern is reliability. And then, of course, it can be valid in terms of the results and outcomes of research. All right? So here, we relate SOP patient safety culture survey data to outcomes. So importantly, they end in view of why we care for our patients is satisfaction of our patient, and they will be able to obtain optimum level of health. Correct? It is actually a quality of life that they have to live. All right? And then research have shown that significant relationship exists between SOPs, patient safety culture scores, and important healthcare delivery measures and outcomes. All right, take a look at this. So some key findings includes when there is hospital unit and more positive SOP scores, like they had few hospital acquired what? Pressure ulcers and patient fall. Take a look at that. So it's being minimized. It's avoided. The risk of fall is actually minimized because of research findings and outcomes. And then second example is lower surgical site infection rates. Okay, so fewer and then lower. All right, so meaning to say you're minimizing. Okay, and then harm to our patients. Another data on hospital with more positive SOP scores having lower rates of in-hospital complications or adverse events as measured by AHRQ's patient safety indicators. So there are indicators as part of the questionnaires. And then patients who reported more positive experiences with care, well, of course, that's what we call optimum level of care, and then satisfaction of client. All right? Would you agree with me? Yes. Okay. Then in nursing home, for example, these are examples. Higher centers for Medicare and Medicaid services, nursing home, five-star quality ratings. Can you imagine that? Especially right now, there's what we call medical tourism. Okay, so our patients or our clientele really is fully satisfied. Like they are being taken care of as VIPs or like the so-called five-star healthcare safe practices. Therefore, it's actually like zero error possible. Okay, and then another item is lower risk of residents fall, and then long stay urinary tract infections, and short stay ulcers. So these are a few of the conditions by which when you ensure culture of patient safety, even healthcare practitioners' safety, then it will be down to lessening complications, lessening fall, and then, of course, short stay within the hospital and early recovery. All right, so almost I'm towards the end of my talk. Are you okay still? Okay, so let's ask the question, what does the literature say? So with this literature, this actually entitled Perceived Safety Culture of Healthcare Providers in Hospitals in the Philippines. So it actually having a finding that requires the group specific intervention should be campaigning for to improve patient safety. So in other words, there are factors to consider, and that there are perceived reactions, bureaucracy, and then proactive levels that is being required in a certain area of assignment, and then only those who have received safety culture at reactive levels have significant differences in their scores together with the length of experience at reactive. So interestingly, a significant difference was found to the type of hospital, to almost all safety culture levels except at the bureaucratic level. So the findings will guide hospital leaders. Take a look at this. Will guide hospital leaders. So, in other words, these are similar practices in the Philippines and some others like Indonesia, and then Europe and America, and even Saudi Arabia and some other Middle Eastern countries, that leadership is very important to provide safety culture of healthcare in hospitals, particularly in the Philippines. All right, so I hope you can resonate with that, translate that to your field of practice. You're a healthcare provider. Now, how do you see yourself? Could you do it on your own, or it requires somebody, it requires leadership to take the lead, to take some policy reviews and surveys, research, so that it will actually be more of a beneficial part for both ends, administration, and then staff or employee, and then we go into clientele, and then towards our goal of patient safety. All right. So, well, if you have more time, then you can actually read further about this interesting result. But it actually like use the patient safety culture assessment tool that actually brought light to the findings that leadership is very important to give focus on strategies to improve patient safety, and it has to be enhanced. Okay, another one is on patient safety culture in selected government. Take a look at this environment, and then the kind of, or the nature of organization also matters, say private hospitals versus government hospitals. So in the Philippines, it's very obvious that government hospitals a lot of patients, lesser budget, okay, to compare with a private hospital that is actually intended for those who can afford. Okay, so particularly in the National Capital Region or towards Luzon, there is improved healthcare practices. So this is actually published in the Department of Health, Department of Science and Technology in the Republic of the Philippines through Herden. Okay, so this is the result and findings. So the literature says that significant differences were found in following. Number one, assessment of respondents about patient safety culture with the length of service in the current unit. Meaning to say, the staff or the respondent is actually longer in the stay in a unit. Remember the organization, unit, these are multi levels, and then departments, right? And then eventually going to the system. So it has a factor to consider on the length of stay to to test factors in relation to hospital management, assessment of the respondents and patient safety culture, with the average number of work hour per week as test factor in relation to hospital management, assessment of the respondent and patient safety culture, the level of hospital as test factor in relation to patient safety grade and assessment of the respondents of patient safety cultures with the profession of respondents as test factor in relation to hospital management. So come to think about it, it's not just only one factor, but multi-factor, multi-level um, engagement of all these things towards the development or ensuring patient safety culture. All right, so that's the second article. And then the third article is actually development and preliminary evaluation of patient perceptions and safety culture in a hospital setting scale. Take a look at this. If you're going to study the authors of this article, they actually represent a lot of areas. Like there is a registered nurse, a registered midwife, a master in health administration, and then meaning to say the multidisciplinarity is helpful in the crafting of some plans of patient safety culture, ensuring patient safety culture in an organization. So the findings concluded that the study offers preliminary evidence on the psychometric properties of newly developed tool that measures patients' perception on hospital safety culture. So remember this, very important is the tool, the survey tool, remember? And that it is actually subsequent studies on larger samples and to be conducted to determine the reliability and validity of the tool when applied to different population and contexts, as well as determining valid cutoff points in scoring and interpretation. So here, it's really very important that when we try to ensure patient safety culture, we actually are basing it from evidences which are scientific by nature, and that is helpful when we try to understand the need for research concepts. Okay, would you agree? Thumbs up, please. Okay, so then the fourth one is actually patient safety culture among nurses at a tertiary hospital in the Philippines. So there are also primary, secondary, and then tertiary levels. So how does it look like if the patient safety culture among nurses will be in a tertiary level? Okay, so this study concluded that the nurse value teamwork. Okay, are you familiar? Say the word teamwork. Okay, so within units and organizational learning, continuous improvement. Take a look at this. It never stops. It goes on, and we're talking about sustainability in here. All right, so the process is continuous and we're looking for improvements. That's why regular survey is helpful, and we determine PSC level should be at a continuous process. The first step should be obtaining the support of what? Can you read this? I cannot hear you. All right, it's administration and assuming a non-punitive approach. Take a look at that. The blame-free environment. Okay, would you agree with me? It's a blame-free environment, or it's a non-punitive approach to those who make and report medical errors. So that's why students, please, every now and then, if you're not sure, then you seek help from your preceptor. And then you articulate, you openly communicate. This is the first time that I'm going to give this medication. I don't know this. That's why it's also very important that prior to going to duty is we study our drugs, our medication ahead of time, the mechanism of action, how does the drug act, and what would be the nursing responsibility, what are the side effects, adverse effects, so that we can anticipate, right? Okay, so to those who make and report medical errors, therefore, do not be afraid in reporting medical errors. If the problem of personnel not reporting events is to be resolved, any barriers to reporting should be identified and addressed. All right, so usually in the Philippines, we are afraid being called, being asked to explain. Now, this time, we are developing a culture of non punitive blame-free environment so that we'll be able to establish where in the system is there something wrong, why the error has been made or has been carried out. And so, in the next few months or in the next few years, then we are reducing the incidences of medication error. All right? So, towards the second to the last is a comparative study on patient safety culture to strengthen health systems. Take a look at this. Health system, the whole system among Southeast Asian countries. So this is actually a bigger scope. All right. So the results showed that it's very important to to do more of evidence proactive project planning, as I've been mentioning earlier, and must be scientific, that we implement to be concluded to integrate patient safety culture into the health system of developing countries. And towards health policy, very important is the review of health policy or crafting a health policy if there is none on patient safety and quality service for the attainment of sustainable development goals in South Korea development cooperation. So this is true to South Korea, although part of the assessment, one is from the Philippines, and then more is in Indonesia, about eight. So more or less, I think you can relate on quality assessment and analysis among Indonesians, Thai, Malaysia, Malay, Vietnam, and then Singapore, and then Philippines. All right? So that's it. And I would say maraming salamat or thank you very much for your kind indulgence and in listening to my presentation. And I'm really honored that through this, we can get started with our collaboration. Thank you very much. And I give back to the moderator.
Okay, thank you so much.
Thank
Please
you.
give applause to
Thank you very
Neil.
much.
Thank you so much for your kind and your great presentation. Actually, here we truly understand about your presentation regarding about the patient safety, right? And
Okay.
we can continue
Good.
to the next session, that is a question and answer session. So
Mhm.
maybe all of the participants who want to ask about the patient safety, about our topic today, please just raise your hand and mention your name, mention your study program, and also mention your question. Okay.
Mhm.
Okay. Okay, maybe you can say it in bilingual. The first you say it in
Hello.
Bahasa, and then the next you can say in English, right? So all of the audience know about what is your question.
So I can speak in Indonesia and English.
You can speak in Indonesian or in English is actually.
Oke, terima kasih. Perkenalkan saya Rahmadiyah
What's
dari farmasi.
what's your name?
My name is Ran. You can call me Ran. It's like a running, and
Ran?
I'm from yes. It's,
Okay,
A nice
Ran,
name.
Ran.
Yes. Yeah, and I'm from pharmacy major. Actually, what I'm trying to ask is why this research focus in Philippines, why not other country? But we know that patient safety is very patient safety focusing in many country. Why the research focus in Philippines? And the second question I have is we have not just physically, not just physically patient safety, but we have like mental. We not just focus the yes, like not the physical one, but we have mental safety patient. So what are you thinking about that, and what the response of patient that we need to learn? That's
Okay.
the question. Okay, thank you.
Yes, I got it
Thank
right.
you.
Very
Give applause to
good.
Rani.
And, yeah, you've got a nice name and must be athletic. I won't be running. Okay, so thank you
Okay.
very much. Two things here. Number one is on research. I'm sorry and my apology. You actually got it differently when I say doing research in the Philippines.
Keep quiet, okay?
Doing research in the Philippines is actually the same in Indonesia right now and all parts of the world when we have the importance of research as a basis on scientific evidences that we have to continuously improve. How do we prevent errors in medication? Particularly if I'm going to relate it with pharmacy, there is what we call a problem now on multi-pharmacy. Like a person, like older person, has to take a lot of medicines. Now, with the condition of an older person, maybe memory, or there's no one, there's no significant other facilitating in the administration of the daily maintenance of an older person. Therefore, this is happening that there could be some errors. Therefore, it's very important that we value surveys and research so that our policy, our protocol will be refined and thus minimize or eliminate errors in taking our medicines, particularly in the context of older person in the Philippines. So I don't think so that Indonesian older person also is not having problems like taking a lot of medicine at the same time. All right? So that's one very important aspect. And then second is on mental health. Definitely, ensuring a culture of safety in the Philippines does not only mean medication error. The challenge of the 2025 healthcare practitioners, particularly, or even in the workforce, is burnt out. Meaning, I have mentioned this earlier, that a government institution or a government hospital facility in the Philippines has a lot of patients. And then only a few health practitioners, like the workforce, there is a shortage. So therefore, the result is burnout. And when an individual is burnout, mental health is affected. Therefore, the challenge of administration, as I have mentioned earlier, and even researchers have proven it, that administrative support is very important. Now, if we're going to relate it to your university, maybe in your unit, the faculty, the pharmacy department. Now, your leadership there, your administrators, your faculty must be conscious and must be sensitive on the status and condition of mental health of individuals like students like you, or mental health of faculty and staff. Because at any rate, we actually need to collaborate and we work together to ensure a culture of safety. I hope I am able to answer the two questions, and I hope it's very clear. Then I can actually articulate further. Thank you.
Okay, I think is it very clear about the nail presentation, right? That's, I'm sorry, maybe we can explain in bahasa about your answer, right?
Sure.
Ya,
Sure.
jadi,
Go ahead, please.
ya, jadi menurut Nil ini tidak hanya pada kesehatan fisik ya yang ditanyakan oleh Mbak Rani tadi ya, pertanyaan yang sangat bagus bahwasanya kenapa sih kok risetnya kebanyakan dilakukan yang di Filipina. Sesuai topik kita pada pagi hari ini, kita akan melihat bagaimana budaya pasien safety atau keselamatan pasien itu dari perspektif di negara Filipina. Sehingga mungkin banyak ditampilkan di sini adalah hasil-hasil literatur atau studi atau penelitian sebelumnya yang mengarah pada bagaimana pasien safety itu dikembangkan atau mungkin sedang sedang diteliti, karena penelitian ini merupakan suatu dasar dalam sebuah pengembangan keilmuan. Dan yang kedua tadi terkait dengan mental gitu ya, sesuai dengan komponen daripada pasien safety diantaranya adalah komunikasi yang efektif. Sehingga barangkali kaitannya dengan farmasi tadi sedikit disinggung. Hello, quiet please. Oke, jadi terkait dengan uh, pengobatan gitu ya, mungkin bisa jadi seseorang itu tidak hanya mengalami kelelahan secara fisik, tetapi dia juga mungkin sudah mengalami kelelahan secara mental dalam pengobatan yang cukup banyak dan juga dalam waktu yang sangat panjang seperti itu. So, Neil, thank you so much for your answer. Maybe Mbak Rani, anyone to ask again, or is it clear for you? Okay, thank you. So I hope if you wanted to be pharmacist, you will be have a principle, yeah, to doing good, avoiding harm, especially in medication error. Okay, okay, okay. For the next question, okay, just raise your hand and then stand up. Mention your name, your major, and your question.
Magandang umaga, Prof. Martin. My name is Bilkis Nailati Zakia, a student of Hospital Administration. Thank you for your insightful presentation. It was a truly eye-opening. May I ask you a question? In the Philippines, is the patient safety incident reporting system already digital and accessibility to the public? If so, has it helped improve public trust in the healthcare system? In Indonesia, we still face challenges with data transparency regarding medical incident. Do you think the Philippine approach could be adapted to a similar context like ours? Thank you.
Okay, Alan.
Yes.
Okay, Neil, you got it. The
Thank
question.
you very much. Yes,
Okay.
I've been listening. And
Okay.
this is something to do with the data privacy law. And in the Philippines, we are not actually full-blown upgraded when it comes to technology. And so, like the electronic medical records, not all hospitals do have that. But nevertheless, um, we actually still have the narratives written uh, by hand, and we can also like have it encoded. Yet, we are actually submitting it to higher up, like the administration, for further review and analysis as to how the incident happened and what were the measures being taken care of, and then eventually addresses the concern and pinpoint at what point in the whole process in the system did we make an error, and how do we address that as an improvement continuously in the next days, weeks, or months in as the procedure is being carried on from time to time. So definitely, very salient points would be we are in the Philippines, we are embracing technological advancement, digitalization, but not all hospitals or the systems in healthcare are actually having the full-blown EMR and then digitalization in terms of communication. We still have to work on with encoding and then writing the narratives and then submission to higher up for deliberations and further analysis of what took place in certain incidents. All right, I think that will be something for the translation of Bahasa, and
Yeah.
then hopefully if the student is satisfied, then we can work it out or like add on later on for some query. Thank you.
Okay, thank you, Neil. Maybe I can summarize on your answer that to build medical error and then or the increase the patient safety, especially in administration, right? We need to collaborate between the patient safety aspect and also the digitalization aspect, right, Neil?
Right, and the question is if we can actually borrow your practice in Indonesia, yeah, that would be very helpful as well. Your system is kind of British, ours is kind of Western, so we can actually merge certain practices, and that would be very helpful for Philippine practices as well.
Oke, gitu ya. Jadi, I'm so sorry, maybe I can explain in bahasa. So, untuk meningkatkan itu semua, sebenarnya yang perlu kita kembangkan adalah bagaimana kita bisa menggabungkan antara komponen patient safety dan juga digitalisasi. Karena mau tidak mau, suka tidak suka, kita ada tantangan baru yaitu digitalisasi, termasuk di dalam di keperawatan, di keilmuan adik-adik tadi adanya sebuah mungkin sistem error dan lain sebagainya, maka mungkin butuh untuk pengembangan lebih lanjut seperti itu ya. Oke.
If I may add, we have to emphasize the data privacy law, because the student asking the question is more on would it be accessible to the public? Definitely, in certain situations like this, like narratives of incidents, reports because of certain errors, then we are not making it public. We are not trying to expose details or data sets, especially on anonymity and privacy of patient. We have to adhere to that, as well as this is forming part of the so-called principle on do no harm, as I have mentioned earlier. So for the department of the student having raised the question, definitely we take care of the data. And although could be some risks, as I have mentioned, the embracing of technology poses a threat to the use of private data that are actually requiring anonymity and then privacy. So we have to be very careful.
Yes.
Thank you.
Actually, yeah. So about the data, we need to secret the data because the data is very private. So all of the audience, all of the community or the others didn't know about the data, right? Ya, jadi karena data yang kita pegang, data pasien yang akan kita pegang nantinya merupakan suatu rahasia dan ini adalah sifatnya etik, sehingga kalau misalkan kita mengeluarkan data di bukan tempatnya, artinya menceritakan data pasien kepada orang lain, itu juga telah melanggar hukum, seperti itu. Oke, I think it's enough.
Yes.
Okay, it's clear. Okay, maybe the next question.
Alright.
The next question. For my right side, maybe. Okay.
Maybe someone from nursing.
Where is nursing study program? Where is nursing? Okay, you're from nursing? Oh no, where is nursing? Barkul?
Or anyone.
Yeah, it's okay, it's okay. Just raise your hand. Mention your name, maybe. Hello, the committee. Where is the microphone?
My name is Dini from Physiotherapy. How do values, belief, and norm influence the behavior of healthcare staff in promotion patient safety? Thank you.
Okay, from
Yes.
Dini. Yeah, you got it?
Yes.
The question, right? About the
Yeah,
values, about the
very
ethics.
succinct question, because I have mentioned this, that if I may reiterate the question, how does culture affects the in ensuring cultures of patient safety? Definitely, in the definition earlier presented by the World Health Organization, these are factors to consider. One of the factors to consider that is actually on norms, values, and beliefs. So I made mention that, say for example, in the physical therapy department, if you do not believe that when you try to handle the patient's transfer from bed to stretcher, for example, and that is forming part of your rehabilitation, then definitely you will commit an error and will put the patient to risk, particularly the incident of fall, because you don't mind, you don't believe that if you have to be very careful, then it will either prevent fall of the patient or perhaps some dislocation of the bones, because you do not believe that there has to be some protocols that are mindful of the safety of the patient. That's one. On the other hand, I have gone through being a medical surgical nurse, and basically I handle patients that are post-stroke patients, and I actually accompany the patient every day down to the rehabilitation center. So with that, I make sure that as a nurse, I take blood pressure before the patient goes down and be wheeled to the rehabilitation center. Then upon receiving, the PT also takes blood pressure um, as a form of baseline before the PT or the physiotherapist will have to work on with the required regimen for rehabilitation. Because we know for the fact and we believe, we value, and that is the norm, that in every activity the patient has to undergo, may it be passive or active um, ranges of motion, then it will increase blood pressure, right? So this is how important the factor of culture may influence our efforts to ensure patient uh, safety culture. Because if not, then definitely we could be harming the patient from time to time without believing, without having these standards or protocol or norms, and without this value of care to our patients in certain situations calling for the care under, say, physiotherapy experts and practitioners. So culture is very important as a factor to consider in developing such culture of patient safety. Thank you very much, and maybe Bahasa translation
Okay, thank you, Neil.
can be done.
So we can say that about the values, belief, and also the norm is also the plays important role to increase the patient safety culture, right? Oke, jadi yang ditanyakan tadi itu sebuah dasar ya, bahwasanya uh, value gitu ya, nilai. Kalau nilai itu berkaitan dengan apa yang disampaikan atau yang dianut oleh individu. Artinya ketika kalian melihat itu sebuah kesalahan dalam melakukan atau memberikan pelayanan kepada pasien, maka itu harus segera dilaporkan juga. Itu berkaitan dengan nilai. Kemudian terkait dengan keyakinan gitu ya. Kalau keyakinan itu ya apa yang kita persepsikan ya, yang dipersepsikan terkait benar dan salah. Ketika kamu melihat sesuatu, kamu melakukan sebagai seorang fisioterapi misalkan, kemudian seharusnya kamu melakukan gerakan putaran, misalkan ya I don't know ya, melakukan gerakan putaran, tetapi ternyata kamu tidak melakukan gerakan putaran tersebut sehingga akan memberikan harm kepada pasien itu sendiri. Maka untuk nilai, keyakinan dan juga norma itu menjadi dasar seseorang itu bisa meningkatkan patient safety-nya, gitu ya. Oke.
If I may add, definitely talking about collaboration is a culture. An open line of communication is a culture, from a nurse to a physiotherapist and vice versa. They can actually communicate, they can actually coordinate, collaborate in terms of the patient's care during therapy. And then if we're talking about, say for example, in the scenario that there is increasing blood pressure happening prior to the physiotherapy, then perhaps even given the chance that the patient, the nurse failed to bring the emergency drug for high blood pressure, maybe we can call the pharmacy and then provide us. And then eventually, like, collaboration is real. And if we do it from time to time, day after day, weeks after weeks, and months after months, and years after years, then it becomes a culture. So that's how important culture is. Thank you.
Oke, so Nel menyampaikan bahwasanya ketika kita di dalam suatu healthcare profession, kita akan ada yang namanya kolaborasi. Bisa dari dari nurse to physiotherapy or vice versa, atau sebaliknya dari fisioterapi ke perawat. Itu berkaitan dengan bagaimana mungkin terkait dengan ring of motion dan lain-lain ya. Kemudian ada juga kolaborasi antara perawat dengan seorang farmasi ya atau apoteker gitu ya, berkaitan dengan pemberian obat, sehingga itu harus selalu dilakukan karena itu akan membentuk sebuah habit dari hari ke hari, minggu ke minggu, bulan ke bulan gitu ya, sampai tahun ke tahun, dan menjadi sebuah budaya dalam pengembangan patient safety di rumah sakit ataupun di klinis ataupun di community setting gitu. Oke, maybe one question again or enough? One question again from nursing maybe? Okay, yes. Nursing, right? Yeah. Where is the microphone? You can stand up here.
Okay, my name is Vera Aprilia, but people call me Vera. I'm from a nursing study program, Faculty of Health Science. I ask Mr. Nel Madulara Martin, what is the role of Philippine national policy in addressing the gap in patient safety implementation between urban and rural hospital? Thank you.
Okay, I think is it clear? Clear, yeah.
Yeah, very, very clearly. To be legal in our practice, we follow the law of the land, and there are translation of this law from the national level to certain policies. Say, for example, I am representing the College of Health Sciences for Nursing in our affiliation centers like hospitals and community. So this translation of patient safety is actually from certain laws that covers patient safety in the Philippines. And these are translated according to guidelines and then procedures that is actually safe for all patients possible. And of course, currently we are emphasizing inclusivity, equity, and then diversity, so we also look into that as a factor to consider. But above all, we keep confidentiality and anonymity as we also form part of the implementation of the data privacy law. I hope that is something helpful for the question from nursing department.
Okay, maybe I can translate in bahasa Arab. Jadi ketika menanyakan terkait dengan legal etik gitu ya, Neil tadi menjelaskan di legal etik itu berkaitan dengan banyak hal atau banyak komponen yang harus diperbaiki, mulai dari fasilitas, ekuitas, dan lain sebagainya. Ya, jadi mungkin ada yang disampaikan lagi? Okay, it's enough. Okay, Neil, because there is the last question, so I think this question and answer session is done. So
oh yeah, thank you for translating. Your mantap in translation to Bahasa.
Okay, thank you so much. Okay, actually we say thank you so much for your kind presentation, for your enlightening and your willingness to share your information regarding the patient safety, especially in Philippines. So I was sure that have gained a lot of knowledge and understanding from your presentation, because your presentation is very informative. Yeah, thank you. Maybe we can meet again. And as a token for gratitude, we are honored to present the certificate for appreciation. Okay, maybe you can zoom. Okay, Neil, so this is the certificate is awarded to recognition on your outstanding dedication and effort in sharing your knowledge and experience about the patient safety. Okay, thank
Thank you very
you.
much.
Okay, thank
Thank you to
you.
all of you.
Thank you
Until
so
we
much,
meet
Neil, for
again.
your kind information and your willingness to share with us about the patient safety. Okay,
Yes.
and
Hope to
ladies
see you in
and
person as I visit your university.
okay, ladies and gentlemen, now we are going to the photo session. Maybe for the operators can take a photo session first. Maybe for the operator Umla, so we can see in the one frame.
Mm.
Okay, is it okay? Okay, maybe we have any some error on the technicians, but it's okay. I would like to say thank you again to you, Neil. And I just to inform you that our Faculty of Health Sciences have one journals that has been accredited by national accreditation. Maybe if you
Wow.
want, yeah. So if you wanted to join to be our international editor, so I'm very happy. So
Yeah, sure, at all times. And my pleasure being part of the editorial board as an
yeah.
international reviewer. Thank
Okay.
you. And
Okay.
congratulations for your journal.
Okay. Thank
All the
you.
best.
Okay, maybe I will send email to you
Yes,
about
please.
the editorial assignment about your
Yes,
name and the others in our journals, right? Okay,
sure.
I hope we can next collaboration, but in education, in research, and also in community services, right? So,
Yes, great. Thank you very much.
okay,
We will
you're
be
welcome.
honored because we are now partners.
Yeah, thank you very much, Kin. So, dear all the audience, finally we go to the last session. So, let's close our agenda today by reciting Hamdalah together. Alhamdulillah, Rabbil Alamin. The guest lecture 2025 held by Faculty of Health Sciences in collaboration with International Affairs is officially closed. So I hope all of you get new insight, new information regarding the patient safety. Thank you, and I apologize for all of the mistakes. Thank you so much, and see you on the next guest